Today on Special Edition TV, the challenge of healthcare and how one company is giving back to make a difference.
Welcome to Special Edition TV. I'm Ileana Bravo. The healthcare debate continues to arouse strong feelings among many Americans, and oftentimes many of us feel as though our voices are not being heard. Today, in our Corporate Social Responsibility segment, I had the opportunity to explore a program that's actually giving voice to many who feel they've had a difficult time being heard. Healthcare, and more specifically access to healthcare, has been a challenge for many Americans, especially for ethnic and racial minorities. So much so that 10 years ago, Aetna Healthcare's former CEO, Jack Rowe, commissioned a study to capture data on people with racial and ethnic disparities.
People asked him the question of, don't you think it's racist to do so? And his response was, well, I actually think it's racist not to, because the belief is that genetic makeup and the socioeconomic factors that impact people's lives every day have a true impact on the way they react to the healthcare system and use the healthcare system.
And for Alejandra Campos, who suffers from diabetes, inadequate access was devastating.
3 years ago and a half, I started losing my sight. I actually went blind. I had a retinal detachment on both the eyes. I had cataracts on both the eyes, plus I have hemorrhage on both of the eyes. And I was looking for someone to help me with my situation because I was denied from the hospitals. I was denied for every single help that I wanted.
At the time, Alejandra had no health insurance. She was too poor and, as an immigrant from Mexico, didn't know or understand the often complicated procedures needed to gain access to government programs.
I did go to the optometrist, but it took me a long time because we don't have that much money. They told me that they couldn't help me. They told me, you need to go to the emergency room. Y ese día fui a la sala de emergencia. Me fui al hospital, el hospital me recibió, me chequearon los ojos, me dijeron, sí, te está pasando algo en los ojos, tienes dañado los ojos, pero ahorita el doctor no está en el hospital, tienes que venir mañana.
The next day, the doctor told her she would need surgery to save her eyesight.
Le digo, okay, está bien, go for it. I need a surgery, and if it's possible, let's do it right now. The doctor actually was prepping me to go to the emergency room that instant. I had my gown, I had everything on me, and then the financial people came into the room and told me, how are you gonna pay for this operation? I told them, well, they told me, do you have insurance? I go, no, I don't have insurance. Do you have medical? They're like, no, I don't have medical. I said, then how you expect for you to pay this surgery? Like, you know what? I will pay you on payments. If you allow me to give it to you on payments, I will gladly, surely do it, and I will be on time with my payments. They looked at each other. The doctors, the nurses looked at each other, and then they looked at me and they told me, you know what? Unless you don't have $20,000 on your pocket, I can't do anything for you. I felt worthless. I felt like I literally told my husband, you know what? I'm just gonna go blind.
So going blind with nowhere else to turn, Alejandra came here. This is Latino Health Access in Santa Ana, California.
Latino Health Access works to build healthy communities and to fight health disparities and to fight for equity. We wanted to create an organization that could invite people to be part of the solution. You have diabetes, I train you about your diabetes, and you better learn because you are going to be a trainer. And then people with diabetes started training people with diabetes. And people that were victims of domestic violence started training people with. And people that had issues of weight and lost weight started training people in aerobic classes, etc. And we became this army of people that understand that you learn to teach. Knowledge comes with the commitment to share the knowledge. And that's what Latino Health Access has been doing for 18 years.
Running a nonprofit organization like Latino Health Access requires a dedicated team, as well as charitable funding. And support has come from a very unlikely source. In this case, a major healthcare provider, Aetna.
Aetna has always been focused on creating opportunities for people to live healthier lives.
At Aetna, we serve some 20 million members, and those members come from very, very diverse backgrounds. There are issues with health literacy, there are cultural issues with regard to preferences, there are comfort levels as it relates to speaking with doctors and, in fact, challenging advice that's been provided.
And in Washington, D.C., Aetna teamed up with the Martin Luther King Foundation to help sponsor the Martin Luther King Memorial as a testament to his work empowering people.
An offshoot of that program was also to bring the energy around Martin Luther King's legacy into the communities where we live and serve. Then we created Aetna Voices of Health. This program was created to celebrate the work that's being done at a local level around closing the racial and ethnic equality healthcare gap. So 35 organizations were nominated from across the country. A website was developed, a social platform was developed as well, so that these organizations can tell those stories. Then we allowed America to vote. And America then voted and selected the organization that they felt was doing the best job in closing the racial and ethnic equality healthcare gap.
We were so happy when we were notified that we won, because this means $25,000 for the programs, $25,000 that in this agency go a long way.
It just makes sense for us to partner with an organization that's already doing all the groundwork and be out there with them in the community as a corporate entity, and make sure that people know that we care about their health.
With $25,000, we do classes for an entire year. $25,000 help with the physical activity for the kids for the entire year. $25,000 pays for eye surgery for people that could go blind. So for us, $25,000 is a fortune.
Because of Latino Health Access's unique relationships within the medical community, Alejandra's surgery cost only $5,000.
For once, I feel like I'm not denied. For once, I feel like somebody's listening to my story. I feel like somebody cares. Aetna, they're helping Latino, and by helping Latino, they were helping me.
Aetna has always been committed to the communities that it serves. And so we believe that we need to continue to invest in those communities. And so our programs and approaches to making sure that we have racial and ethnic equality inside the healthcare system only generates a healthier community.
We are very grateful to Aetna because they didn't need to do this, and they did it. They didn't have to commit themselves to reducing disparities, and they did. They didn't have to commit to improve equity in healthcare in the US, and they are committed to do that. So we are very grateful on behalf of every person that will benefit from this award, directly or indirectly. The many people that now will have educational materials for the classes, or that will be able to enjoy physical activities because now we have how to support them on an ongoing basis. Thank you so much, Aetna, on behalf of our community.